Hi, it's Michael DiDomenico with Circling the Sleep World, Michael D. Today, joining me, we have two experts from ACHC to discuss the top 6 deficiencies in sleep lab surveys. Racheal Graham is one of our guests. She's a corporate surveyor with ACHC working specifically on the sleep accreditation program. Racheal has been with ACHC for over 5 years and brings substantial experience from the hospital and healthcare industry. Additionally, she plays a vital role in ensuring accreditation partners meet quality standards by conducting surveys across the country. And Deborah Panza recently joined the ACAC as a director of DemiPost Sleep and Mobile Dentistry. Panza brings 25 years of experience working with the respiratory therapy, sleep, and DemiPost programs in the University of North Carolina UNC Health System. She's a licensed registered respiratory therapist, as well as a registered polysomnographic technologist. Her practical understanding of regulatory compliance combined with decades of frontline patient experience uniquely position her to understand what providers need to use the accreditation process to add value, improve business efficiency, and elevate the care they deliver to their patient populations. Ladies, welcome.
Thank you.
Hey, Michael. Thank you. We're so excited to be here.
Yeah, thanks for being here. How are you today?
Great.
Wonderful.
Yeah. So we're going to discuss these major deficiencies, and but before we get to that, Deborah, tell us a little bit about the ACHC and what it's all about.
Yeah. So ACHC is an accreditation organization accrediting customers since 1986 as deeming authority by CMS, accredits organizations nationally and internationally. Currently, we provide accreditation for 20 programs, 7 certifications, 19 distinctions, plus educational courses and workshops. Some of the programs include acute care hospitals, home health, hospice, ambulatory care, pharmacy, DemiPost, sleep, mobile dentistry, and many more. So ACHC takes a very educational approach and takes a deep dive into these deficiencies. And that's what's published in our biannual surveyor newsletter. And this is our topic of discussion for today.
So the surveyor newsletter, you do that twice a year. And does it always look at deficiencies, or does it examine different things in each newsletter?
It always reviews deficiencies, and they do the top ones for each program. So this is kind of a nice review for our customers to see where others are maybe struggling with twice a year for all of the different programs that we offer.
That's great. So we're going to talk about the 6 areas of deficiency. Racheal, the first area is program and service operations. This is the first area of deficiency. What does that mean to a sleep lab director, manager? How do they improve that, and what are you looking at there?
Of course. So just an overview of what that deficiency is. The sleep lab is required to provide their patients with information that covers how to communicate a grievance. And we require that they have the ability to communicate a grievance to the organization itself. We want them to provide the relevant state agencies, and we want them to provide them with ACHC's contact information. So a couple of tips for compliance. Ensure that the patients are being provided with pertinent contact information. So make sure that they're getting something that's providing the state regulatory bodies hotline, the customer's hours of operation, phone numbers, the accrediting organization, and then how to contact these companies with a concern, a complaint, or a grievance.
That's the first area, major area of concern, right?
Right.
And then we move on to fiscal management. And Deborah, I think we all know what that means, but know how that works in a sleep lab, and it's not just sleep labs. You guys do accreditation for not only sleep labs and clinics, but also for home sleep testing. So tell us that area in fiscal management and why that's always seems to be deficient.
Yeah, so a little overview is just that under the fiscal management, the patient is advised of their financial responsibility for their care or service at or prior to the receipt of that care or service. So the tips for compliance is that the provider is providing clear explanations of the charges and expectations of the reimbursement at the initiation of the service, and documents the acknowledgement of that communication. So this could be accomplished in multiple ways, such as documenting in the patient record by the individual having that conversation with the patient about their financial responsibility. Also, patients can sign a document that they obtained that information about their financial responsibility. So the citation is about 14% of the time. It's not found in the patient chart. So it's really about documentation.
That's kind of crazy that people aren't really made aware of their responsibility. I guess that does lead to a lot of, you often hear people talking about, I had no idea I was going to have to pay that much money.
Right. Or they're leaving at the time that they're finding out that information. And that kind of what we're trying to keep from happening is, we understand that you're not going to know down to the penny what your patient is going to owe, right? Because it's really going to depend on how their insurance goes through and what claims are happening. But we do want them to have an idea. And that way they can be making an informed decision before they come in to have that test versus showing up, registering, finding out there's a very large bill or copay due, and are left frustrated, and you're left frustrated because now you have a hole that you can't fill, right? Because it's nighttime and, patients are already done for the day. So it's more about making sure they're well informed and that you're documenting it, right? So the hospital probably had this conversation with them at some point, but did they document it somewhere? That's what we're looking for.
And the next area of deficiency is human resource management. I can tell you, I went for a sleep test and nobody was there. So human resource management that night was terrible. How does it, what are you seeing in this deficiency? What typically happens? Where are they falling short?
So for this particular deficiency, it does fall under human resource management, but it's more about the sleep lab's medical director and or their certified sleep physician participating in monthly education for the personnel. So we do require that there are certain criteria that their staff is reviewing every month, and we do want the medical director to be part of that. So what we're finding is they're not conducting it at least monthly. So, tips for compliance there would be conducting at least a monthly in-service in training, but also documenting the attendance. The other piece is there's multiple ways that you can include your medical director in monthly education. This could be your medical director is providing this education in person to your staff. They're joining via a platform, a virtual platform, or you're providing your medical director with a review of the education you're going to be providing the staff throughout the year and have your medical director sign off on this. The most important piece is documenting how you are meeting this standard. So maintain a log of what you're reviewing, who attended, and then how you included your medical director or sleep physician in this education.
Documentation has to be key, right? In everything you guys do. That's what you need. If there's no paper trail, there's no document. It didn't happen.
It didn't happen. That's right.
So then we have, Deborah, I think you're taking this one, provision of care and record management. This is number 4 on the deficiency list. Yep. What's going on here with this?
So a little overview on that the standard ensures that an individual record is maintained for each patient, that the record contains specific required elements. So basically the policy and procedure includes requirements of the items that are included in the patient record, such as a pre and post sleep questionnaire, Epworth sleepiness scale, type of HST device, etc. Checklists are useful to verify that all items are included in the patient record. This could be a good chart audit tool. Typically, the pre and post sleep questionnaires are missing from the HST documentation. And this is something that can be used to monitor like PI for performing patient record review.
Then we move on to quality outcomes and performance improvement. These are steps 5 and 6. How can they improve in these areas, and what do you look at?
Just to give you a quick overview, what falls into this quality outcomes and performance improvement. So this is about the organization developing and maintaining an ongoing organizational-wide performance improvement program. We want to measure and analyze and track quality indicators. And then we want an analysis of the data for the sleep center to assess processes of care, the services that they're offering, and the operations of these services. Tips for compliance here is you want to ensure that your PI activities that are required by the standard are all inclusive. You want to ensure that you're reporting on everything that is required. So some of these are going to be a summary of your adverse events throughout the year, satisfaction surveys. Are you completing annual clinical competencies on your staff? Are you reviewing your patient complaints? Is your scoring tech participating in a inner scoring reliability program? Or is your medical director reviewing the scoring to ensure that they're meeting this gold standard? And then, is your medical director signing off on your PI reports? Are they part of your performance improvement activities? The second piece of this is ensuring that you're taking all of that data that you've collected throughout the year and you are writing an annual performance improvement summary. This is where you would summarize all of the things that you reviewed throughout the year and what you did. So some tips for compliance would be create written annual performance improvement report that covers all of the required and selected activity, what the findings from those activities were, and then any corrections that you made from reviewing the data. Although the annual summary is a final report, it's a single document, the improvement efforts that come with that should be happening throughout the year. So make sure that you're using your monthly or your quarterly PI audits to spot trends and find ways to make improvements. That's the real goal of your PI. Review your current PI, complete your annual summaries, provide corrective actions, and then provide outcomes. What did you do to make it better? So, keep in mind, performance improvement is not just a requirement to meet a standard, right? It's a valuable driver of your organization's success.
So if I'm going to have a survey, I want you guys, I've got my sleep facility. I've contacted ACHC. I want you guys to come in. I've never done this before. I have never been accredited before. What do I need? What should I have ready to make this process as easy as possible?
So the nice thing is, it's not going to be just you, right? So you're going to have access to an account advisor who's going to take you through all of the steps of accreditation. They're going to do a checklist with you to make sure that you have all of the key components, that they're all in place. They come up with a readiness date is what we call it. And that's the day that you believe that you're going to be meeting all of the requirements that we set forth and you're ready for us to come on site. So what we're going to do is we're going to look at everything from that point on. But this is not just a solo mission. You always have someone with you along the process to get you through accreditation, from the account advisor to your surveyor. After your survey, you're back to the account advisor. There's someone always in touch with you, answering questions, taking you through the process. And the nice thing is about ACHC is if you are meeting Medicare requirements, billing requirements, chances are you're meeting most of our standards already. It's just a matter of us coming in and helping you fine tune all of those processes, getting you ready for success. So, that's where it's at.
You're going to partner with me, right? This is going to be a good experience. This isn't like an IRS audit.
Correct. Right. But something to be excited about. Right. Surveys are something to be excited about. You want us there. You want us finding what's happening so we can help you make it better, right?
Yeah. It's a step towards excellence.
We're your partner.
And ACHC has over 600 sleep customers that are accredited. This is for sleep centers and home sleep testing. The accreditation period is for 3 years. Some surveys are virtual and on-site. There's no membership fees, no annual fees. It's all-inclusive pricing. The sleep center requirement for the medical director is that they're an MD or DO. The interpreting physician must be board certified in sleep. And the sleep clinic is not required. So we accredit customers from the smallest 2-bed lab to the largest corporate size accounts. We strive for the best customer experience and ensuring compliance with quality and supplier standards. We work with customers by providing guidance throughout the accreditation process and ultimately help customers identify strengths and areas for improvement.
So once we've done this and we've got everything done and all the recommendations, I'm feeling great about how things are going. The lab is humming. How do we stay engaged? How do we keep this relationship going? How do we stay on top of this?
Absolutely. What you can do is you can minimize your last minute stress, right? So you don't have to just wait until it's time to be reaccredited and you start pulling all of these things together. You stay engaged with us throughout the entire accreditation cycle. You can connect with your account advisors to learn more about your performance improvement tool. We have resources, we have workbooks, we have all of the things to help you be successful throughout your accreditation period.
Do you have coloring books? I really like those.
Not yet, but we are definitely working on them.
Accreditation coloring?
Right. That's next.
Okay, you don't have the coloring book yet, but all of your tools and all of your information can be found at achc.org. They can reach your customer service at achc.org. That's a handy email address. And they can also reach you guys at 855-937-2242. If you're interested in accreditation for your sleep services, ACHC is a great place to do that. You get to work with people like Racheal and Deborah here. They are really committed to your success and making sure that you're accredited, and just really good stuff. Anything else you'd like to say before we wrap it up?
Just thanks so much for having us on your show, Michael. It was a pleasure to get acquainted with you and get to talk about ACHC. We hope that we're able to assist our customers on their accreditation journey, and we hope they reach out to us for any additional information.
Awesome. We'll put some links in the description area, and they can also, grab the stuff there and some other documents and things. So, but thanks for being here, Deborah and Racheal.
Thank you. Thank you.
All righty. Take care.
You too. Bye, guys. Thank you.